better stay skinny like those Korean girls, or I'm gonna beat you up. Alright?
We got that exam. It was so hard.
So hard. I can't.
It's the worst.
I think I failed it. I really don't know. Like, I studied so hard too, but
It was horrible. Some of those questions.
Hi, sweetie.
Oh my god, you dyed your hair.
Do you like it?
I love it.
Yeah, I want to try something new, so I think red should be good. I like your purple hair though.
I'm gonna have to dye mine too before we're going to nursing school.
I know, this is why I'm doing this right now. We stay in high school, can do whatever we want.
Have you been studying?
Yeah, the whole time.
I don't even
Can't
have
do
time.
anything else.
There's so much stuff we need to do.
I know.
I'm so stressful.
Do you want some fruit?
I'm good.
You're not gonna have lunch?
Yeah, I have my Hawaiian bread. You guys want some?
Yeah. Oh, sure. Oh, those are my favorite.
Thank you.
I just don't want to eat anymore.
You need to eat something.
I do, sometimes.
How are you gonna be able to study for your exams if you don't eat?
I'll eat while I'm while I'm studying. Yeah. So you guys gonna keep eating?
Yeah, you should come eat. Yeah, I haven't had lunch.
I think I'm gonna go study, and I'm gonna eat when I'm studying.
Okay.
See you guys later.
See you. Bye. Have a good day.
You too.
Have you ever seen her eat anything? I don't know how she can.
She's been losing a lot of weight.
I know. I think she's stressing herself out too much.
I think so too with all the studying.
You know what? I'm gonna use the bathroom real quick.
Okay.
Go home.
Hey,
Oh my god, hey!
how are you?
I'm good.
Hi guys.
I haven't seen you in forever.
I know. Are you in the nursing program?
What time?
Oh, nice.
How is full time?
It's good. It's
You're
a lot,
almost
but
done?
yeah.
I don't know. Wait. I don't know how you do it.
I know, I'm already like stressed out. All the homework, ATI exam, adaptive quiz, I can't do it. I don't
I
know.
don't know how you're doing it. You just had that mental health exam. That.
Oh my god, I'm gonna be mental health patient myself.
hard. I've gotten so fat after this whole nursing.
Oh my gosh, you
That's
are
how I
not
feel the
fat.
same thing. Do you look fat?
You guys are just shut up. You're ridiculous. Come on, have some
I feel
fruit.
so fat. I'm not gonna eat. I'm still looking at my food. Ew. Do you want some of my food?
I'm not gonna eat it. You should eat something.
You want some? Crackers?
Sure. Thanks. Okay.
Yeah, I'm fine. So you look fine?
You look stressed.
Nursing school, you know, I think it's normal.
I'm tired.
Do you look fat?
No, not at all. That's not what I was saying. No. You are not fat. Actually,
I don't know, I feel fat. I feel like this nursing school just makes me fat.
actually, you look a little thinner than the last time I saw you.
I
faster than you.
I have twins.
Oh my god, I'm just gonna go.
Okay.
Well,
Eat your food.
I'll eat later.
Okay.
I'll see you guys later.
Bye. Good luck.
She looks really skinny. I'm worried about her.
Her face just looks skinny and tired.
I don't know what's going on with
I
her.
hope she'll be okay.
You're gonna eat that?
Oh, no, you can have it. Okay, so the doctor has diagnosed you with bulimia. I'm sure he came to talk to you about it, right? Some of the reasons why is because of your weight, it's slightly low, and you may have noticed problems with your teeth, and that's due to the vomiting. You may have experienced muscle weakness, as you mentioned to him, and you have low sodium, which is one of your electrolytes, and that can be bad for your brain and your nervous system. You also have low potassium, which is not good for your heart. You might start having heart problems if you don't make changes, and your stomach could rupture as well. So we're going to start you off with some cognitive behavioral therapy, which will help change your thinking as well as your actions. And the doctor will prescribe some antidepressants for you, and we'll have to observe you when you eat for at least an hour to make sure you're keeping everything down. We will be checking your weight daily, and it might help you if you keep a journal. So here's a journal for you, and you can just write your feelings and your thoughts as you go through this process. You can also write what you're eating and just how you're feeling about everything, and that can help you get through this. Okay? Do you have any questions for me?
No, I think I'll try.
Okay. Glad you came in, eh? The doctor has diagnosed you with anorexia, and it seems that you're so afraid of gaining weight that you're just not eating. This is already having some negative effects on your health. You've lost a lot of weight rapidly, and you have a low heart rate, low bone density, low muscle tone, and you have a low potassium level, which can be really bad for your heart. I can help you come up with a plan to gain some weight if you'd like.
I guess.
Okay. First we can talk about some of the foods you like to eat, and we'll start there. You can just start eating that type of food and start with small meals. And I have a list here of group therapy, different group therapies that you can go to, and it can help sometimes to talk to other people who are going through the same thing as you. And once you've reached your normal weight, then the doctor will prescribe you medications that can help maintain your weight, such as antidepressives like SSRIs, such as Prozac, and antipsychotics such as Zyprexa. These can help you, like I said, maintain your weight as well as help with your mood. And it can also help to keep a journal, and you can just write down all of your thoughts and your feelings as you're going through this process and trying to gain weight and trying to get better. Okay? Do you have questions?
No. Thank you for helping me.
You're welcome.
I hope I can go to nursing school with this.
I hope so too. You will. You can do it. Good morning, ladies. How are you? I'm so glad you guys made those healthy changes and you graduated and now we get to work together. We have some interesting cases today. One is an anorexic patient and another a bulimic. Do you guys think you can take those on?
Yeah.
Yep. Okay. And I just want to go over what some of your nursing diagnoses will be, as well as your expected outcomes. And here they are. All right, so give me one nursing diagnosis that you might use.
For my patient, nursing diagnosis is going to be imbalanced nutrition less than body requirement, related to reduced oral intake as evident by lost 30% of body weight in 6 months and hypokalemia.
And now an outcome.
Within 1 week, patient will gain 1 to 2 pounds.
All right, B. So what would be your nursing diagnosis for your bulimia patient?
For my nursing diagnosis, ineffective coping related to feeling of loneliness as evidenced by overeating to comfort self and followed by self-induced vomiting.
And what would be your expected outcome?
And then the outcome would be within 2 weeks, the patient will identify 2 alternative methods of coping with loneliness.
Good job, ladies.
We got
We got this. Woo!